former aim are the various programs that has been into the CHSC vertical of QAI. The first one is art, productive home healthcare. We have dialysis center, green healthcare facility, clinics, ambulatory care facility, telehealth, hotel and homestays, emergency department, transition care centers, hospitals, WHO organizations, hair transplant clinics. These are already there, and we are in the process for launch of hematopoietic cell transplantation and cellular therapy product collection, processing, and administration. These are the number of healthcare accreditation that has been done in past 7 years under CAHSC. For art, we have 59 centers, home healthcare 7 centers, dialysis 8 centers, WHO certification 1, ambulatory care facility 5, then telehealth we are having 2, emergency department 10, transition care center 4, stroke centers 27, hospitals 7, certification of hospitals 1, clinics 1, vision centers 19, and QAI 7101 1. So total 2 has already been accredited by QAI. International recognitions. QAI India to achieve its score EEA accreditation in less than 5 years of operations. QAI accreditation is recognized by Ministry of Health, Central Government Health Scheme CGHS for empanelment of private hospitals, eye centers, dental centers, and imaging centers. QAI is the first and only accreditation body in India having two standards accredited by ISKUA, that is, accreditation standards for home healthcare, also accreditation standards for hospitals. This is the accreditation mark of QAI that we provide after complete inspection and assessment of the hospital and other centers. Benefits of accreditation. So, for patients, patient person, people centric care, empowered patient, high quality of care, increased patient safety. Patients get services by competent staff. Rights of patients are respected and protected. Patient satisfaction is regularly evaluated. Transparency in treatment cost. Ethical consideration. Then benefits for art centers. Accreditation stimulates continual improvement, enables the organization in demonstrating commitment to quality and safety, helps building community confidence in their services, increased credibility, reduce wastage, transparent operation, provides opportunity to healthcare facility to benchmark, system for self-regulation, staff retention, also increased business, international medical travels. So these were the benefits for art centers. And also, accreditation helps the benefits for staff, that is, increased staff satisfaction as it provides opportunities for continuous learning, good working environment, leadership and ownership of processes, increased staff safety, increased confidence through QMS, that is, quality management system, support professional development. So, as today's webinar is on accreditation program for assisted reproductive technology, that is art centers, framework of art accreditation standards. This set of accreditation standards have a defined framework, making them easy for art centers and assessors to use. These standards are categorized into 10 chapters. Each chapter is divided into a number of standards, and each standard is further divided into a number of criteria. Criteria is a measurable element to evaluate the compliance against that specific standard. The first five chapters are focused on the organizational functioning, and the last five chapters are focused on patient care. 10 chapters altogether cover all components of care continuum in an art center. So this is the framework of art accreditation standards. So we are the first edition that was launched in March 18. We were having 10 chapters, 91 standards, and 421 criteria. And the second edition, that is the rich one, that has been launched in November 2020, 100 standards and 543 criterias. Standard and criteria. So now we will see what is a standard. A standard is a statement that defines the structure and a standard is a statement that defines the structures and processes that must be substantially in place in an organization to enhance the quality of care. Criteria is a measurable component of a standard and acceptable compliance with the standard. Framework of Art Accreditation Standards, second edition. According to second edition, these are the 10 chapters and the number of standards and criteria against each chapter. So this is the table. The first chapter is governance and leadership, GAL 8, and number is, in this we are having 9 standards and 38. The third chapter is FRM, that is facility and risk management. Under this we are having 18 standards and 123 criteria. The fourth chapter is IMS, Information Management System. Under this, we are having 8 standards and 42 criteria. The fifth chapter is CQI, Continual Quality Improvement. Under this, we are having 8 standards and 43 criteria. The sixth chapter is PAC, that is Patient Assessment and Care. Under this, we are having 14 standards and 53 criteria. The seventh chapter is Patient Rights and Education, PRE. Under this, we are having 7 standards and 42 criteria. The eighth chapter is MMS, that is Medication Management and Safety. Under this, we are having 10 standards and 60 criteria. The ninth chapter is SCS, that is Surgical Care and Safety. Under this, we are having 7 standards and 40 criteria. The last but not the least is HIC, Hygiene and Infection Control. Under this, we are having 11 standards and 67 criteria. So, the first 5 chapters that are basically organization focused, and the last 5 chapters are basically patient centric chapters. So, overall, we are having 100 standards and 543 criteria. So, we will go into brief detailing about chapters, like what a chapter constitutes. So, the first chapter is governance and leadership. In this, each center requires a governance structure that is ultimately responsible for the quality and safety of services provided. This responsibility is derived from its legal identity and operational authority for all activities undertaken by the center within the ambit of applicable laws and regulations. Each center, regardless of its complexity, also has a formal structure. Leaders ensure that a system exists that promotes safety and quality, provision of services that meet the of patients, availability of adequate resources, human, financial, physical, and monitoring and evaluation of improvement activities. That is HRM, Human Resource Management. This consists of human resource include all the people that work in for or with the center, and they are integral to ensuring the delivery of quality, centered, and safe care. The center must be able to assure the public or patients that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff. The support includes the management team providing a safe physical environment for staff to work in, which is free from harassment or accidents. So, this is all related to staff safety and quality. The third chapter is FRM, facility and risk management. In this, we are having the center will prevent people from receiving unsafe care and treatment, also prevent avoidable harm or risk of harm. Safe, high quality care and support is intrinsically linked to how resources are used, including how they are planned, managed, and delivered. Centers must assess the risk to people's health and safety during any care or treatment and make sure staff have the skills, experience, competence to keep the patient safe. Premises and equipment must be safe and available in sufficient quantities. Good clinical and good laboratory practices are followed in all its operations. Center must prevent the spread of infection. Next chapter IMS, Information Management System. An effective information management system is based on the information needs of the center. The system should be able to capture, transmit, store, analyze, utilize, and retrieve information as and when required for improving clinical outcomes as well as individual and overall performance of the center. Information can be in any form, paper or electronic or a mix of both. Next chapter is Continual Quality Improvement, that is CQI, chapter 5. In this, we talk about the quality processes that we follow in the center. Quality improvement recognizes that the safety of the patient is paramount. A center that is focused on quality improvement continually looks for ways to promote patient safety and quality of care. Quality and safety improvements in healthcare include a patient safety improvement program that requires healthcare providers to proactively identify risk and to plan, implement, and evaluate necessary changes to improve the quality and safety of services. The center ensures regular evaluation of these programs through performance indicators and benchmarks to identify both positive outcomes and areas for improvement. Any necessary actions to improve the quality and safety of the services are implemented, and learning is disseminated both internally and externally. The next chapter is chapter 6, PAC, that is patient assessment and care. And from this chapter, the patient centered chapter starts. So, under this, patients are made aware of the services being offered through different modes. Processes are defined for various activities, including registration, admission, referral, and discharge. Patients once taken into the facility either as an outpatient or as inpatient are assessed and reassessed as per policy for their clinical and treatment. So initial assessment and reassessment both is required. Chapter 7, patient is in the center of the care being provided in an art center. It is therefore important that patients' rights are documented and known to the patients. It is also important to provide education to patients related to their care. Better satisfaction or outcome is achieved when patients are adequately informed about their care, their rights are respected, and they are involved in the decision making process. So, these things that we need to follow for better patient outcome. Chapter 8, Medication Management and Safety, MMS. The purpose of medication management is to provide a framework for safe and effective medication management system. Safe and effective medication management system includes the processes for procurement, storage, prescribing, transcribing, preparing, dispensing, and administration. So, from procurement of medicines to the administration of the medicines, the whole process is need to be safe and effective for the patient. All processes of medication management of the center comply with rules and regulations of the law of the land. Chapter 9 SCS, that is Surgical Care and Safety. It is important that the art center has adequate facility and knowledge to carry out various procedures which are current and based on evidence as far as possible. Different policies and procedures are required to be in place to ensure that procedures being performed provide desired outcomes and care is safe. Surgical procedures adhere to best practices for use of anesthesia. So, under this, we provide policies and procedures that look after the use of anesthesia and also the surgical procedures in a safe manner for patients. The last but not the least, chapter 10, that is HIC, Hygiene and Infection Control. Changing technology and disease profile continue to present new challenges for infection prevention and control within healthcare facilities. Patients are at developing healthcare associated infections because of decreased immunity among patients. The increasing variety of medical procedures and invasive techniques, creating potential routes of infection, and the transmission of drug resistant bacteria among crowded center populations with poor infection control practices. Healthcare associated infections are among the most common complications affecting patients. So, we need to follow hygiene and infection control practices, which includes hand hygiene, BMW maintenance, and care bundles that we follow in the hospitals and other centers. So, these were all about the 10 chapters that we have for accreditation program. Now we will look after the accreditation process. So this is the flow of the accreditation process that we follow in QAI. The first is self-assessment. So the center has to do a self-assessment where they stand for the accreditation. Then application plus SAT plus documents plus fees. So the center will apply with the and they will submit the application form along with the self-assessment toolkit, along with the all regulatory and required documents and the fees. Then the third step is review, registration, and acknowledgement of application. So, as the center will submit their application along with the required documents and SAT and fees, so QAI Secretariat will review their application. We will register their application and we will provide them an acknowledgement of their application. Sorry, just a minute. After sending the acknowledgement of application to the center, the document review, on-site, remote, hybrid. So we can plan the assessment on-site, also remote, also hybrid assessment can be planned. And then after the assessment is done, report review including scoring and non-compliances if any. So if after the assessment, if there is any NCs raised by the assessors, that has to be in the next step, the center has to submit the corrective action for all the non-compliances. After that, after the submission of corrective actions from the center, the review by accreditation committee will be done by QAI, which validates the score and acceptance of corrective actions. After the accreditation committee grants the assessment process, the issue of accreditation certificate will be done, which will be valid for 3 years, as the validity is for 3 years only. On-site surveillance assessment will be done within 15 to 18 months of accreditation. And then renewal of application, that is 6 months before expiry, the center has to apply for renewal. So this was the whole process. So this next we will look after the fee structure for art centers. So this is the fee structure for art centers that we have divided according to the number of embryos transfer in art center per year. So in case the art center comes under the category of up to 300 embryos transfer per year, so their fees will be application fees will be 25,000 and the annual fee will be 1,25,000. And for the if the center comes under the category of above 300 embryos transfer in art center per year, so the application fees will be 50,000 and the annual accreditation fee will be 2 lakhs. Then we are having a fee structure for level 1 clinics, that is for art clinics where only intrauterine insemination procedure is carried out. For this, we are having application fees of 20,000 and annual accreditation fees of 60,000. Then self-assessment toolkit. Each criteria is scored at a scale of 10, 5, 0 or N on the compliance as per the below principle. So we are having a scoring methodology. Is compliance to the requirement. If there is the compliance is more or equal to 70%, then we can give 10, we can score 10 or 5 under the 30 to 69% of samples are complying. Non-compliance to the requirement, if there is less than 30% of samples complying, we will give 0, we will score 0. And not applicable, that is NA, there may be a possibility that some of the standard criteria is not relevant to a specific type of facility organization. So in such case, the standard or criteria shall be rated as NA. So this is the scoring methodology. And evaluation criteria for accreditation decision. So the facility or organization must meet the following criteria at a minimum for consideration of the accreditation award. In addition, an action plan with corrective actions taken to be prepared for addressing criteria having received a score of 0 or 5. So no 0 is accepted in the regulatory legal requirements. The average score for individual standard must be more or equal to 5. The average score for individual chapter must be more than or equal to 7. And the overall average score for all the chapters must be more than 7. So based on this, the accreditation decision will be taken. So any question and answers we are having? This was all.
If we need to start the
In case
accreditation
anyone is
process,
having any question.
hi,
Yes, sir.
this is Jitendra Kumar
Yes,
from Test
yes, sir.
IVF. Uh, I'm heading the HR department here. So if we need to
Yes.
start the this accreditation process, what can we get some contact number or some so that we can have the coordination over there?
Yes, sir. We are having info@qai.org.in. You can send your request, or you
Okay.
can just share your number to us on the
Okay.
chat box. I will directly
Okay.
connect with you.
Fine enough. I'll just text you my mail contact number.
Yes, yes, sir. I will note that. So we have shared a feedback form in the chat box. So everyone, please fill the form. And if anyone is having any other query, okay, so we got your number. Thank you so much.
Otherwise, we can we get this PPT also, whatever you have just brief here?
That will be available. That will be available, sir.
Okay. Okay. Thank you.
I would request all to please open up their cameras, or we will take a screenshot. Hello, good afternoon, everyone.
Good afternoon.
So much. So we will end today's session for now.
Thank you.
Hope you all had a good time.
Same to you. Thank you. Bye.
Thank you, sir.